Hi, my name is Kate Gethman, and today I am going to be discussing research that I've recently completed regarding mentors for new RNs. So why this topic is important to me? Well, first, I am in my third year of nursing school, meaning that in a short year and a half, I myself will be on the job hunt as a new RN. I want to go into graduation and this job hunt with a firm understanding of qualities that I look for in my potential employers and just an overall general idea of what kind of employer I want to work for. Unfortunately, I have had past experiences where I felt my employer was not invested in me nor excited about the attributes that I brought to the table. With my employer not investing in me nor making me feel excited, it was hard for me to be excited about working for them. And if I am not excited about the job that I'm doing, that makes for a long career. Knowing the past experience that I've had, I want to prevent any future experiences from being similar, which is why mentorship programs really interest me, because I do believe that with the use of mentorship programs, it leads to a more successful opportunity for the employee. I came across this topic during the first research log that was due. I completed a brainstorming session where I wrote down seven ideas or so on topics that I found interesting. Mentors were one of the first topics I thought of, and throughout the entire brainstorm process really stood out. So it was an easy decision when I was done which topic to pick. For the project, I interviewed Katie Sauter. Katie was a charge nurse within the CHI hospital system. I say was because she recently left based on working conditions. When I asked Katie if they had a mentor program or anything similar, she said no, and actually that they had quite the opposite, where they very regularly were understaffed due to budgets. Katie was a night shift charge nurse, so she very commonly worked with new RNs, because as I'm sure many of you know, the night shift is a very common place that fresh graduates find themselves working. Katie felt that she was stressed, she had a lack of support, and was very overworked, and was beginning to feel burnt out. If Katie felt that way, an experienced nurse, I cannot begin to imagine what a new nurse must have felt. Katie does believe that if that job would have implemented some kind of a mentorship program, they would have seen better retention rates, and her herself may not have left when she did. I reviewed 3 articles as well for this project. The first article was by Kate Jemay, titled Past Program Introduces New Membership Component. This article was a little different than the typical mentor in a hospital setting. This mentor program was designed to help nurses who already had their RN license transfer countries, in this scenario Canada. I found it important to research mentorship as a broad term and not just as a one-on-one in the workspace term. The program so far has had great outcomes. It's rather new. It's roughly a year old. The mentorship part started in August of 2016, so they are still finding results on that. The next article was by Sarah Jane Jones, establishing a nurse mentor program to improve nurse satisfaction and intent to stay. In this article, Sarah specifically looks at emergency department nurses. She states that job satisfaction has been linked to retention, adequate staffing in acute care. And then finally, the last article June Levine wrote. It's titled Transition to Practice, Part 1, Implementing the AAA-CN Ambulatory Care Nursing Residency Program. The importance of structural framework. So in this program, it was a residency instead of a mentorship, but in general was the same idea as the mentorship. June states that new graduate registered nurses and RNs new to a clinical specialty have been expected to quickly integrate into a complex environment with little to no transition, support, which often leads to high stress, practice errors, patient safety concerns, and turnover. Strengths that the articles had is the survey of participants. Each article surveyed participants, both mentor and mentees, throughout the entire process. All programs also had an orientation period. Orientation was required for both the mentor and the mentee to be included within the study. If somebody did not go through orientation, they were not allowed to participate. I think that was a great idea for these programs because it ensures that there is no confusion and everybody is on the same page. And finally, the length of program. I feel the lengths were all adequate times. They were, other than the past program, they were all 1 year, which I think is enough time to develop a relationship and really feel confident in the job itself. Weaknesses, I felt it was a rather one-sided discussion. There was no research indicating what nurses who were not included in the mentorship program felt or what their job satisfaction and retention is like. There was also a lack of data in some, and the programs were very new, especially the past program, so knowing how effective it is still a little immature. And these are my resources.